Good afternoon, everyone. Thank you so much for joining us for this webinar, Ohio Unwinding of the Medicaid Continuous Enrollment Provision. My name is Haley Aka. I'm the Vice President of Operations and Strategy at HPIO, and we're glad to have you here with us today. Next slide. HPIO is an independent and nonpartisan organization. Our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending in Ohio. On the next slide, I'd like to take a minute to thank our core funders who advance our mission with their steadfast investment in our work. And on the next slide, I also would like to thank our educational event series sponsors for 2024 for their generous support of these events. I'll also note, since this is our very first educational event of 2024, that there is still time to join us as an educational event series sponsor. If you're interested in that and supporting these types of events, we'd love to talk with you. So feel free to reach out in the question box or via email about that. All right, on the next slide, we have a little time during our agenda today to answer questions. So as our speakers are presenting, please feel free to type any questions that you have into either that chat box or the question box, and we will address them either there in the chat or out loud as time permits. We'll also have some poll questions for you at the very end of our agenda today, so please stick around for those. Next slide. Today's presentation slides and other related resources will be available on the HPIO website. They can be found by clicking on the Events tab at hpio.net. We have a full agenda today, starting with an overview of the unwinding process in Ohio from my colleague at HPIO. We're then going to hear updates from both the Department of Medicaid and from the Ohio Job and Family Services Directors Association today. First, though, I'd like to share just a little bit of background on the Medicaid program for those of us who don't work in this space every day, just as a bit of a refresher. Next slide. The Medicaid program provides healthcare coverage for about 3.55 million Ohioans with low incomes. These are children, older adults, people with disabilities, and low-income adults who cannot otherwise afford private or employer-sponsored health insurance. During the pandemic, Medicaid enrollment increased by about 30% in Ohio, largely because of some federal policy decisions related to the public health emergency, and we're going to learn more about that today. Medicaid is a significant share of state spending in Ohio. About 39% of state spending went to the Medicaid program in state fiscal year 22. The program cost about $35 billion that year, with the federal government reimbursing the state for about 73% of that spending. The federal government reimburses states for Medicaid spending through a payment arrangement called the Federal Medical Assistance Percentage, or the FMAP. The federal government increased FMAP payments during the pandemic. We're going to learn more about that today as well. On the next slide, we can just take a quick look at who is eligible for Medicaid. There are three primary categories of Medicaid enrollment, and each group has its own income requirements. There are the covered families and children group, which includes children, parents, and pregnant women. There are low-income adults in the Group 8 category. And lastly, there's the age-blind and disabled group, which includes adults over 65 and people living with disabilities. For more sort of foundational information on the Medicaid program, we'll see on the next slide our Ohio Medicaid Basics document. This is a place that you can go for sort of that foundational information on eligibility, covered services, spending, and some recent policy and program changes in the Department of Medicaid or with the Medicaid program. So with that sort of foundational background, on the next slide, I'm happy to introduce my colleague, Adit Nkanyani. She is the lead author of our Medicaid Basics line of work, and she's going to walk through the information and findings from our latest brief, Unwinding of the Medicaid Continuous Enrollment Provision. Take it away, Adit.
Perfect. Thank you so much, Haley. Good afternoon, everyone. Again, my name is Edith Nkenganyi. Next, please. All right, let's jump right in and start with the COVID-19 public health emergency. So back in March 2020, the federal government declared the COVID-19 public health emergency retroactive to January of 2020. Which included the Medicaid continuous enrollment provision. The continuous enrollment provision ended at the end of March 2023. The provision basically set to state that if you take the additional 6.2 percentage point increase in the federal medical assistant percentage, or the FMAP, you cannot disenroll anyone from Medicaid during the public health emergency, regardless of their eligibility status. This means that people who were enrolled in Medicaid couldn't be disenrolled regardless, unless they opted to do so themselves or if they passed away. Typically, the state Medicaid agencies are federally required to review eligibility of most Medicaid members every 12 months. Those who are still eligible continue their Medicaid coverage, and those who are considered ineligible are disenrolled. All states, including DC, opted to take the additional 6.2 percentage point increase in FMAP, which means that all states are now implicated in the Medicaid unwinding process. Back in December 2022, the federal government decoupled the continuous enrollment provision from the public health emergency and allowed states to start disenrolling people from Medicaid as early as April 2023. Next, please. Here's what the timeline of Ohio Medicaid unwinding of the continuous enrollment provision looks like. Ohio started its unwinding process back in December 2022 and is expected to wrap up by the end of March 2024. Next, please. During the continuous enrollment provision period, Medicaid increased in Ohio by about 30%. As displayed in this graph, enrollment started going up in March 2020, which is when the public health emergency was declared. Enrollment continued to increase until January of 2023 and has been decreasing since April of 2023, which is when Ohio started disenrolling people. Next, please. Now let's take a look at the unwinding process in Ohio. This graphic shows the eligibility determination process. It is important to note that the eligibility review are happening mostly at the local level through the county departments of Job and Family Services. Next, please. Going through the process step by step. First, 2 months before a Medicaid member renewal due date, the Ohio Department of Medicaid, or ODM, attempts an automated renewal, also known as auto ex parte renewal, through the Ohio benefits system. The Ohio benefits system contains administrative data such as wages. Once ODM is done with the auto ex parte review, they send out renewal notices to those who are successfully renewed. In the second step, if somebody cannot be renewed through an auto ex parte process, their case is sent to Public Consulting Group, or PCG, a third-party data vendor that ODM is contracting with. PCG uses additional data available to them to identify each case as likely eligible, or likely ineligible. And then that information is sent to county departments of Job and Family Services. The caseworker renew people who were found eligible by PCG. In the third step, for those who are found to be likely eligible or likely ineligible by PCG, more information is needed from them to make a final decision, and a renewal package is sent to enrollee's address. This process is called a manual eligibility review. Once the information from the renewal package is received, the caseworkers conduct a manual eligibility review and send notices of renewal or disenrollment to enrollees. Those who are found to be ineligible have an opportunity to appeal the decision without losing coverage. They have up to 30 days to do so. Next, please. Proceeding to step 5. Those who do not return their renewal package are disenrolled and have up to 90 days to submit the requested information without going through the Medicaid application from the beginning. Procedural termination or procedural disenrollment occurs when enrollees do not submit their renewal package. Much of the emphasis during unwinding has been on reducing procedural termination. The state has implemented multiple strategies to that end. In step 6, cases that are initiated but not completed by the end of the month are rolled over to the next month. Lastly, in step 7, the Centers for Medicare and Medicaid requires that each state submit a monthly report on renewals, disenrollment, and pending renewals. Next, please. The state have faced different challenges regarding unwinding. In some instances, CMS has forced certain states to pause disenrollment to correct their unwinding process. For example, in August 2023, CMS alerted state that some people with Medicaid coverage may have been disenrolled incorrectly because of a methodological error for a state that were conducting eligibility determination on a household basis instead of an individual basis. In September of 2023, CMS estimated that about 500,000 children and others nationwide had been improperly disenrolled and were expected to regain Medicaid coverage and require some state to pause procedural termination to resolve the issue. About 20,000 people in Ohio were impacted by this error. ODM worked with CMS to comply with federal requirements and have since fixed the error and re-enrolled people who were improperly disenrolled. Next, please. Now that I've provided you with the background on the continuous enrollment provision and how an Ohio unwinding process, let's take a look at unwinding progress in Ohio. Here are 3 key findings from our analysis of Ohio unwinding progress. 1, 3 out of 4 Medicaid enrollees in Ohio with completed renewal have kept their coverage. 2, Ohio Medicaid enrollment dropped by 259,670 people since March of 2023. And lastly, more than 15 million people nationally have been disenrolled from Medicaid as of January 16, 2024. Next, please. Thus far, most people who have had their eligibility reviewed in Ohio have retained their Medicaid coverage. As shown in this graph, 74% of people with completed renewals have maintained coverage as of October 2023, while 26% have been disenrolled. Of those who have been disenrolled, 74% were disenrolled for procedural reasons, such as not completing the renewal process. This means that the vast majority of people are being disenrolled not because they no longer qualify for Medicaid, but because they did not complete the renewal process for whatever reason. Just for reference, in October 2023, ODM conducted an analysis of July 2023 procedural disenrollment and found that about 53% of those who were disenrolled were determined likely ineligible by PCG analysis. Ohio mirrors a national rate of disenrollment for procedural reasons. Next, please. As I mentioned earlier, Ohio has been witnessing a decrease in enrollment since April. From March to October 2023, enrollment decreased by 259,670 people. Among the decrease, 28% were children and 72% were adults. The decrease in enrollment accounts for people disenrolled due to the annual eligibility redetermination related to Medicaid unwinding and for other reasons, such as death, change in income, and relocation. Next, please. Nationally, at least 15 million people have been disenrolled from Medicaid as of January 16, 2024. Ohio is disenrolling fairly fewer people compared to other states. Ohio has the 11th lowest rate of disenrollment as seen in this graph. Also, Ohio is completing more renewal on an ex parte basis than 37 other states. For example, in July 2023, the average ex parte renewal rate among 49 states and DC was 30.7%. Ohio ex parte renewal rate for the same month was 40.1%. Next, please. As the unwinding process continues, many more Ohioans will likely lose or experience gaps in coverage. Some people who were disenrolled for procedural reasons may still be eligible or may need assistance with enrollment or re-enrollment. Others may be eligible for subsidized coverage through the federal health insurance marketplace. The marketplace special enrollment period is open until the end of July to allow those disenrolled from Medicaid to get health coverage through the marketplace. Navigating the health insurance system is always so challenging, especially for those with limited knowledge on how Medicaid and the marketplace works. The federal government increased funding for the Navigator program to assist individuals with renewal and the unwinding process. Ohio Navigators, led by the Ohio Association of Food Banks, are helping individuals explore health insurance options, complete forms, gather requested document, and ensure that their mailing addresses and other contact information are up to date in the Medicaid system. Next, please. In summary, here are the 3 key takeaways from the Ohio current progress of the Medicaid continuous enrollment provision. 1, most people in Ohio are retaining their Medicaid coverage. 2, Ohio Medicaid enrollment dropped by 259,670 people since March. And that the enrollment is not all, the decrease is not all related to unwinding. And lastly, more than 15 million people nationally have been disenrolled from Medicaid as of January 16, 2024. Next, please. If you would like to keep up with Medicaid unwinding, here are some resources to help you. The KFF Medicaid Enrollment and Unwinding Tracker provides monthly data on unwinding, including Medicaid enrollment, renewals, and disenrollment. This includes both state and national data. Also, ODM posts monthly unwinding reports that they submit to CMS on its website. The reports include information about Ohio unwinding progress. Also, please feel free to reach out to me with any questions. Thank you so much. Are there any questions for me, Haley?
Thank you, Adit. I'm not seeing any questions in the chat. We've had a couple people ask questions about where to find the slides for today. So I'll let you all know that if you go to hpio.net and click on the events button at the top, you'll find today's event, and that's where you can find the slides and other materials posted for today. If you have other questions for Adit or for our team, please feel free to post those in the chat. I have a couple of materials to drop for you all related to this that I will do right now. I will also, I'm being reminded that the chat is disabled. That's right. We have a large group today. The chat is disabled. That Q&A box is open though. So please put your questions in that Q&A box. We'd be happy to answer them there. All right, I'm going to turn it to our next speaker, who is Patrick Beatty with the Department of Medicaid. Patrick is the Deputy Director and Chief Policy Officer at the Ohio Department of Medicaid, where he oversees bureaus that manage a wide range of programs and services, including eligibility, enrollment, health plan policy, waiver programs. He's worked on matters involving Medicaid in various roles in both the public sector and private sector for over 25 years, and he's been intimately involved in the unwinding process here in Ohio. So he's going to give us an update on unwinding from the department's perspective. So take it away, Patrick.
Thank you very much. Thanks everybody for participating today. I've got some good materials and information to the presentation was a nice segue to what I'm going to be talking about, which are some more recent updates and critical issues in the space of unwinding. Next slide. So for those of you who are familiar with it, you'll remember that we started the resumption of normal Medicaid eligibility operations back in February of 23. We had our first affected renewals were April renewal due dates. That's April of 2023, whose coverage ended at the end of April. So the first period of non-coverage was May 1. The unwinding work that Ohio is doing will carry us through the end of March. The end of March is the end of our unwinding period. And once we reach the conclusion of that month, we will have cycled through a review of everybody who was enrolled on the Medicaid program during the pandemic. During this process of unwinding, CMS ordered some states to pause terminations due to paperwork concerns for what they were calling procedural terminations. Our arrangements, both with our ex parte process and with our back-end review of cases using the PCG third-party data sources, made Ohio compliant with the federal requirements. We were not asked to pause our terminations. There was an issue during the unwinding that almost every state was caught up in, and it had to do with review of households versus review of individuals. Some states actually had to stop their unwinding work entirely while they found a solution. We were able to pivot immediately and developed a solution internal to the Ohio benefit system that now does eligibility reviews both at a household level and an individual level. We have a very efficient and very methodical process. And because of these factors, we've processed more cases than comparable peer states. There are only 4 states that have processed more cases than us. And because of that, we have a very large number of cases that have been reviewed. As some of you may have heard recently, there was news story about the state being on the list of 9 states with large numbers of children losing coverage. The governor received a call from Secretary Becerra. He was the only governor that did. And they had to acknowledge that Well, the only reason Ohio was on the list was because it had processed more cases than any other state and was further along in the process. Not that there was an issue with how we were doing our work. Next slide. So what did we do to prevent erroneous terminations? We used every tool available. If you look at the letter from Secretary Becerra, there is nothing in that letter that he's suggesting that we do that we weren't already doing, starting with the very beginning of the unwinding process. The tools that we have are continued outreach to Medicaid members on our unwinding webpage that we update with regular reports on progress. We've engaged community partners to help distribute messages. We implemented ProComp, which is the state's automated SMS text messaging. That system allows us to reach individuals before any mail goes out and provides a vehicle for the individuals to respond and update their address if the address we have is out of date. We have IVR, our automated call system, that makes reminder calls to individuals who are up for renewal and are getting renewal packets. We use managed care plans and care management agencies to conduct outreach throughout the eligibility review process. So individuals are getting renewal packets. The plans and agencies do outreach to those individuals to remind them and actually to assist them with the renewal process. We've made significant system improvements to streamline the Ohio benefits eligibility and enrollment system. We've made significant improvements to the ex parte process, especially most recently with our individual ex parte, or individual rather than household review. Our ex parte rate in the past month was pushing 60% approval rate. We have the PCG system with third-party data that counties were able to use to do manual renewals and manual ex parte renewals. We have a renewal receive bot that marks cases in Ohio benefits and prevents improper termination, even if the individual doesn't send in a renewal packet, and requires a manual review by a county caseworker. And we have an address bot. The address bot ingests addresses from other sources and updates the addresses in Ohio benefits. And we have a whole slew of what you call E14A waivers, allowing us to utilize a host of tools in order to prevent improper procedural terminations. Next slide. There was a lot of discussion recently about the impact to children. And we have to note that as it relates to populations who are reviewed in our Medicaid program, children represent 39% of the Medicaid population. They only represent 30% of the net disenrollments over that time. So the efforts that we have underway are clearly supportive of maintaining children on the Medicaid program as much as we possibly can. We've disenrolled enrollees, including children, at a lesser rate than comparable states. Pennsylvania, Indiana, and Wisconsin all have higher rates of disenrollment of children. Next slide. We are the 7th largest Medicaid enrollment in the nation. As I indicated earlier, we've processed more renewal cases than all but 4 states. And that's California, New York, Florida, and I forget the last one. So our child enrollment decline is only 6%. And we are average in that regard. Next slide. What you'll see here are the numbers that Secretary Becerra looked to identify the states, the 5 states with the highest number of children decline in enrollment. And you'll see Texas is a league of their own. Florida is not far behind Texas. And Georgia's a surprising one. They're about 1/3 the size of our Medicaid program, and they have more than twice the number of children decline in enrollment. There's a story there. I'm not sure what it is. And then we come to the state of Ohio, which numerically is actually not an outlier when you look at the rest of the remaining 50 states. Next slide. Now, this is the data that the Secretary relied on to identify the states with the highest percentage of decline in child enrollment. You're going to find that we're average, 6%. We're not an outlier. And that is thanks in part to many of the measures that we put in place to make sure that kids who are eligible retain their coverage. And you'll see that when you start looking at states who have upwards of a 30% decline in their child population, they have some serious problems. And they need to find some serious solutions. Some of them have been instructed to stop terminations altogether. Next slide. So what we do on our website is we post a monthly report. It's the report that we send to CMS to document what our performance is on the measures that CMS is interested in. And I'll draw your attention to November and December of 2023. Those were the first 2 months where our system change for individual ex parte or individual review was would show in terms of results. It was actually implemented in October, but the results wouldn't show until November. And what you see is our average procedural termination rate for most of the unwinding was about 19%. It is now down between 11 and 12%, entirely due to the reprogramming. And we are now upwards of 58% in terms of our ex parte auto renewal for individuals. And I think that says a lot as it relates to our ability to change fast when needed, to be responsive to individuals' needs, to identify individuals who may have lost coverage, and we were able to re-enroll. I believe that is the last slide I have for us. It is worth noting that we are well underway in terms of a review of the individuals whose eligibility due date is March. And as you may recall at the beginning of the presentation, March is the last month of unwinding. So we're about a month away from being done. Thank you.
Thank you, Patrick. A couple of questions have come in. It might be helpful for you to take a look at the question box too, if there's some kind of granular ones that you can answer. One point of curiosity for one of our participants here is the story with New York. Why is New York's disenrollment at almost zero? What's going on in New York? Do you know?
I believe New York is one of the states that suspended procedural terminations. So of course they're going to have zero.
Yep.
I can confirm that. This will take me a second.
Sure. Yes, I assumed that is what was going on. There are several states, as Patrick and Adit have both mentioned, for whom that methodological challenge related to sort of household versus individual determination of eligibility was significant enough that the federal government has asked them to pause disenrolling people to get that sorted out. And so there are going to be states that have disenrolled very few people. There's another question about the renewal received bot, what it does and how it works. I don't know if you can multitask looking that up and answering that question.
What is the renewal received bot?
Yes.
So that's a neat little add-on. It is separate from our eligibility and enrollment system, but it functions as sort of a side program. And what that bot does is it's sort of a two-step process. So you've got our PCG third-party data system. It does an analysis of everybody who could not be renewed through the ex parte process. It takes the case information that we have on those cases and then matches it up against third-party data sources that we don't normally have access to. And they have a programming logic in their system, a PCG tool, that has a rudimentary structure of our eligibility criteria. And it produces a result identifying whether the individual's likely eligible or likely ineligible. The county caseworkers can use that information to conduct what we call a manual ex parte renewal. The challenge is that the Ohio benefits system is set up to send out a renewal packet and requests for verification from anybody that could not be renewed automatically. So that renewal packet goes out. And the system is also designed such that if a renewal packet is not returned by a particular due date, the case will be closed. So what the bot does is it takes the information from the PCG system, identifies cases that are likely eligible, goes into the Ohio benefits system, and flips the switch in the individual cases that are likely eligible. So they won't be closed if they fail to respond to the renewal packet. They will go to a county caseworker for review, and the caseworker will then use the PCG data that PCG downloaded to conduct a manual renewal. And that's in part why when you look at our national stats, we have a very high number of cases that are renewed through what is flagged as a pre-populated form. Many of those cases, not a majority, but many of those cases are actually a byproduct of this renewal received bot process.
Thank you, Patrick. One more question before we turn it over to Jim. And there'll still be maybe more that you can answer via text. Excuse
Let's
me.
see.
This person says, we'll do this one out loud.
Okay.
It says, I'm glad to see ODM is implementing so many of the strategies in the CMS letter. What about call center wait times, which was also listed in the letter?
Yeah, the CMS letter was odd because at least at that point in time, which I believe was trying to remember when that letter came out, the CMS letter was odd because the stats that they identified in the letter as it related to call center wait times were not bad. I'm not saying that there aren't pockets of issues as it relates to call center wait times, but the number they had in their letter was not a bad number. And what we found was they used the same language for every single state. They sent the same letter to every single state, whether they had a problem or not. And that's a problem. I mean, you just can't take a form letter and send it to every state and say, there are problems out there, fix it without. So, but yeah, and again, I was just between the Becerra letter and the CMS letter, I thought they were both a little bit odd because they tried to take every state and put them all into this bucket without actually a critical examination about what it is that they were talking about in their letters. So that's my thought on that one.
Thanks, Patrick. All right. Well, if you have a chance to spend some time with the Q&A box, I know there are a couple others coming in that you may be able to speak to. But we'll say thank you to Patrick for now and invite Jim Ashmore come speak with us. Jim is the policy director at the Ohio Job and Family Services Directors Association. He's had a long career in job and family services with some years at the state level and over 30 years at Hamilton County JFS. He's going to give us an update from the local perspective of implementing unwinding through those job and family services local entities. So thanks, Jim, for being with us.
Well, thank you, Haley. Afternoon, everybody. Just to go through a few slides here, it may help to somewhat complement what Mr. Beatty was talking about, as well as what Adit was going over. But clearly, as this first slide shows, it is truly a combined effort with Medicaid unwinding. As you know, Ohio was set up state supervised, county administered, and to that, it definitely takes both parties working together hand in hand, day and night, to make this process a success. So next slide, please. So, a huge shout out to the Ohio Department of Medicaid and all of our state partners for their support, innovation, and strategic thinking when it comes to the Medicaid unwinding space. Clearly, one cannot do it with the other. And a lot of the things that Patrick spoke of, the PCG data, the ex parte process, and the tools that are now available to the county caseworkers to make their jobs a little bit easier in this space of Medicaid unwinding have been welcome additions for sure. Additionally, there have been opportunities for some state funding that have rolled to the counties in hopes of allowing them to have the necessary resources to meet the needs of the citizens in their counties. Something else that is actively working at Ohio Department of Medicaid are county engagement managers. Throughout the state, we have individuals that partner with a point of contact in all the counties. A representative from the Department of Medicaid meets on a regular basis with those individuals to kind of go over the good, bad, and the ugly of what's going on, how they can possibly help. That is a huge effort in hopes of trying to avoid the caseworker just kind of being at a loss and needing to send a less than personal email to an email box that may not get answered by the same folks. This is an opportunity for the partnership to be built even stronger between Medicaid and the county. So that's certainly a welcome addition. For more of the executive level, there are bi-weekly touch points with the Directors Association and Medicaid to kind of check in if there are interesting things that are going on. Maybe it's something that Patrick had mentioned previously about a particular letter coming from CMS, a recommendation, or a pain point, or frankly, it could be a great thing that's coming out of that. But we check in every other week to kind of talk about things and get out ahead of potential pain points as we move forward. Additionally, when you look at the data, this has been a monumental task for sure over the last 10 months or so. But it's definitely something worth pointing out that Ohio as a state is completing timely Medicaid renewals on over 90% of the cases each month that are due. So again, that is something that it takes a lot from counties and from state programming to make that happen, but that is a reality that we're certainly very proud of. Firmly believe at the end of the day, and you heard Patrick kind of talk a little bit about that, when the dust settles of everything with Medicaid unwinding, when we're all done with this, I truly believe that Ohio will be propped up as a model for doing it the right way. Definitely been some hiccups along the way, no question about that. But all in all, I think it has gone as well as we would have hoped. So next slide, please. So this is all about finding the proper balance when we're talking about Medicaid unwinding. This, again, over 3.5 million people that need to have their eligibility redetermined in a relatively short period of time. And with that comes the issues with case churning, commonly referred to as case churning, where individuals may lose their Medicaid eligibility. Maybe it's a procedural termination. Maybe they input something incorrectly. They overinflated their income on their renewal application. Turns out they were eligible. So they go off Medicaid and they go back on. Sometimes, that can speak to some of the problems with the packets themselves. And Jules, I know you would ask a question about, is the process simple enough in that space? It can be confusing to some individuals, certainly. As a result of that, the person may just say, listen, I'm not willing to deal with this right now. I don't know that this is important right now. I've been on Medicaid for multiple years. I haven't had to do this, perhaps because of the COVID emergency. And so I'm just going to ignore it until I have to do something, until I get a follow-up letter. Next thing you know, this individual loses their Medicaid eligibility because they didn't respond. They only find out, they should find out through a letter received or multiple letters received, but sometimes they miss that. They end up going to the doctor or the pharmacy only to find out that they've lost their Medicaid coverage, and they end up wanting to get back onto the Medicaid program. So that's the kind of the case churning piece of it. That is a pain point for the public as well as the casework staff at the county level. So new applicants, obviously during all this, there are still individuals that were not on Medicaid that need Medicaid. And as such, they are going to apply through a various set of ways. They can do that over the phone, they can do it with a paper application, or they can do it online through the self-service portal. But additionally, and we've heard a lot about this lately because of open enrollment, through the federal marketplace, through healthcare.gov, they're able to go out there and complete their application. If they input all of their information, while they may be eligible for a subsidy plan, if they input all their information and it looks like they're potentially eligible for Medicaid, it is going to send that application from the marketplace over to the state of Ohio. The state of Ohio in turn sends it directly to the counties electronically for processing. So that does create a little bit of confusion. As a general rule, Medicaid is Medicaid, but when you look at the various categories of Medicaid that Adit spoke of earlier, it can get a little overwhelming. Frankly, there's a disconnect between an understanding of what is Medicaid versus what is Medicare. Additionally, oftentimes you'll ask an individual if they're receiving Medicaid, and they'll say, no, I'm getting CareSource or pick a managed care plan because all the materials they get after the fact are from that particular managed care plan. And there are certainly numerous categories of Medicaid, that gets a little bit confusing. And we'll talk in a minute about how that can also be confusing for the county caseworkers. But automation is certainly a help in this space. As you heard Patrick talk about, more and more things can be done electronically to kind of help us focus on getting the easy things out of the way so that the county caseworkers can focus on the more challenging situations that require some direct conversation with the customer. So next slide, please. So here are a few of the, kind of the defined, if you will, pain points as we move forward. So next slide. So most caseworkers, if you have been through all of your training, tend to be caseworkers that handle multiple categories of public benefits. So the vast majority of caseworkers that are handling Medicaid are also dealing with SNAP assistance, TANF or OWF, and oftentimes even childcare. And as such, the rules vary by category of assistance you're receiving. So oftentimes it can become a little bit challenging to keep all those rules straight. And with all those programs, there are different income guidelines. The program rules for SNAP and TANF are certainly not the same as the various categories of Medicaid. And it requires a lot of understanding, a lot of in-depth training, and a lot of trying to keep it all straight in your mind as you're working through a case situation. Because when you're trying to determine eligibility for a particular customer, that person more than likely is applying for multiple programs. And again, that gets a little confusing to both the customer as well as the caseworker. So next slide, please. And I only show this, I don't expect you to be able to read it. I know that the print is small, but this is just a sample of what county caseworkers see on a regular basis. This is a chart of allowances that talks about various categories of Medicaid and who's eligible at which income level for which category and the various need standards. Again, it's more just a show and tell effort here to showcase how complex some of these rules can end up being. So next slide, please. So, and I talked a minute ago about this, the kind of the transactional versus transformational work that county caseworkers need to perform. Again, the hope is with a lot of the transactional work that it is simply a yes or no eligibility, that a lot of things can be done through automation. Let that automation take hold. Let those opportunities for the transactional work be handled through automation, and allow the counties to focus on the transformational aspect of what needs to be done. There are quite a few scenarios where a particular customer may need benefits, but it doesn't fit nice and cleanly inside the box of what's eligible and what's not. It's going to require a deeper dive into their personal situation. And the more the transactional things can be done through automation to allow the caseworkers the time to focus on that transformational side, the more challenging and difficult cases, I think the better off we'll all be. And again, it ties in with data entry versus case management. How much time needs to be spent on just absolutely dotting the I's and crossing the T's versus truly getting in and trying to help that consumer or customer or client with their situation and know that we're making a difference in their lives for the greater good. So next slide, please. So certainly none of my slides would be complete if we didn't talk a little bit about the challenges that the counties are facing with staff recruitment and retention. Folks, it can be a very difficult job for the reasons I just mentioned. You know, the various categories of assistance and learning the rules. There is a significant amount of ramp up time to get new staff well equipped and comfortable to do the job. It is not something that you can generally be hired right off the street and on day one learn to do eligibility. It takes a quite extensive process to make that happen. And very candidly, the complex rules can lead to discouragement. The individuals that want to come in to help people, they believe they're people. The people that they're trying to serve, they're going to be able to make a tremendous difference in their lives. And hopefully that is the case, but they can very quickly get discouraged at all the complex rules. And as such, they may just give up on it and say, you know what, I thought this job was for me. It's not. I'm going to move on to something else. And that kind of creates that whole cycle again. We talked about case churning. This is kind of the caseworker churning as well, because clearly the job is simply not for everyone. There's a lot that goes into it. Yes, there is a lot of data entry. There's a lot of learning the various rules and trying to keep all those straight in your mind. There's a lot of call center work, to an earlier question about that. And oftentimes a person is quick to get burnt out on that sort of thing, and they just move on from the role. But at the end of the day, I think those that have been in the job for quite some time would tell you that it is and can be rewarding. And again, speaking from a guy who spent 31 years in Hamilton County, you know, there have been ups and downs for sure, and there have been rules that come and rules that go. But at the end of the day, it is something that you can walk proudly knowing that you are helping those in need. So next slide, please. So just in the interest of more show and tell on the counties, just took a snapshot here of a couple of counties in the Columbus area. Obviously, Franklin County, a very large county, and Knox County, a smaller county. This is just a summary to show how many staff they have dedicated. This is point in time data, so it's not absolutely up to date, but just to kind of showcase the various differences in the counties. But the one constant is every one of them are trying to find the proper balance between the number of staff to do the work based on the number of customers that need to be served in a particular county. Some are structured in one way where they have dedicated Medicaid staff. Others, as I mentioned earlier, and more commonly, are handling ones that are all categories of public benefits because the client is then being served holistically. We have some counties that handle a case banking approach, meaning that there is no dedicated one-on-one caseload to caseworker. It's just first come, first choose. The next one that comes through the line gets passed on to the next caseworker available. So just again, just an opportunity to showcase the differences in counties. So next slide, please. So trying to wrap it up here. I know we're running very short on time, and Haley, I apologize for that. But here is my contact information with my email and phone number. Feel free to contact me anytime if you have questions. And I'll take a quick look at the Q&A here, Haley, as well. But is there anything that jumped out that we need to address?
I think now is a great time I see Patrick still over there in the Q&A. Jim's going to pop in there and answer some questions that have popped in. We just have a few. And while they do that, I'll take this opportunity to thank them both very much for the time that they spent with us, and for sharing all of the information that they shared. And we'll move into the next slide and just sort of wrap up our time together. One more, Jasmine, please. Thank you. Our hope is that these presentations, these webinars that we put out are helpful to you in your effort to influence policy and to improve health and well-being in our state. There are many ways that we can influence policy, both in our organizations and as private citizens, like using data and analysis to inform a policymaker about something, to invite a policymaker to have a conversation with you. With that in mind, we're gonna move to our poll questions. Just gonna let us know a little bit about how you might use the information that you learned today, and just get your feedback on the webinar as a whole. So there's a few questions. If you'll scroll down as you answer, we would really appreciate your feedback as we kick off our 2024 event season. I'm embracing silence as you all take this poll.
And Haley, this is Amy Rowley-McGee, just
Hello.
chiming in here. Hello. Jim, there was a question in the Q&A box around the average salary and benefits package for an employee who works at the county level. I'm wondering if you could respond to that. And also, I just want to say out loud that I appreciated that you humanized the county job and family services workforce. That was very, very helpful. Do you have any data on the salary and benefits package?
Hi, Amy. First of all, thank you for the kind words. I greatly appreciate that. Yeah, the salaries do vary greatly from county to county. As you could imagine, smaller counties tend to pay a little less because there just aren't as many opportunities around. But interestingly, I was just talking to a county yesterday that recently was given the approval to raise the base pay rate of their caseworkers by about 15%. That's a mid-sized county, and it's starting them out now around the 18 to 18.50 per hour mark.
Okay, great. Thank you.
Thank you.
All right, thank you both. We're going to move to our last couple of slides as we close out today. I know Jasmine's doing a lot. Ooh, let's close that. All right, next. slide, please. All of the information that we covered today is available on our website. If you go to hpio.net and click on events, you'll see all of that there. This last slide lets you know how you can connect with us and engage with us and our work. Let us know if there's any follow-up that you would like from us. And then finally, thank you so much for attending today's webinar. We're grateful to see you, and we hope you enjoy the rest of your week.
And thank you to Patrick and Jim for joining us as well.
Of course.
Appreciate that.
My pleasure.
Okay, thank you.
Have a great afternoon, all. Thank you so much.